So hello everyone, welcome back to another recall session. So today we're going to discuss about anatomy recall questions of INI-CET 2024, May and November. So let us start discussing the questions. So the first question is, which of the following joints is not formed by the structure shown in the picture? This structure is known as thoracic vertebrae. Joints formed by thoracic vertebrae is plain synovial joint, symphysis, or secondary cartilaginous joint, syndesmosis. The example of plain synovial joint that is seen in vertebrae is costovertebral joint and costotransverse joint. The symphysis or secondary cartilaginous joint that is seen is intervertebral joint, and syndesmosis is seen anteriorly in the vertebra that helps in the movement. Synchondrosis is actually seen in costochondral joint, means a joint formed between ribs and cartilage. That is not seen in vertebrae. So the joint not formed by vertebrae is synchondrosis. The spinal nucleus of the trigeminal nerve has second order neurons to carry which sensation? So let us discuss all the nucleuses of trigeminal nerve. The first nucleus is mesencephalic nucleus. Location is composed of a column of unipolar nerve cells situated in the midbrain and extends inferiorly to the pons as far as the main sensory nucleus. Function is it receives the sensation of proprioception from the muscle of mastication and from the facial and extraocular muscles. So the main function of mesencephalic nucleus is proprioception. The second nucleus is principal sensory nucleus located at the posterior part of pons lateral to the motor nucleus. It receives the sensation of touch and pressure from the face. The next nucleus is spinal nucleus of trigeminal nerve. It continues superiorly with the main sensory nucleus and extends inferiorly to the whole medulla oblongata till the second cervical segment. The function it receives the sensation of pain and temperature from the face as well as some fiber of touch. So pain, temperature and touch is the function of spinal nucleus of trigeminal nerve. And the motor nucleus of trigeminal nerve location is pons medial to the main sensory nucleus, and it supplies the muscle of mastication, the tensor tympani, the tensor veli palatini, the mylohyoid and the anterior belly of digastric muscle. Means motor supply is provided by the motor nucleus of trigeminal nerve. So the spinal sensory nucleus of trigeminal nerve is responsible for C, that is pain. Other functions are temperature and touch. It carries this sensation from the face. The next question is, which of the following is not seen in the floor of the inferior horn of the lateral ventricle? So we have to discuss the figure of lateral ventricle, and then we can conclude what is not seen in the floor of inferior horn of lateral ventricle. So this is the figure of lateral ventricle. So let us mark. This one is anterior horn of lateral ventricle. This one is body of corpus callosum. This one is the body of caudate nucleus. This one is thalamus. This one is stria terminalis. This is the posterior horn of lateral ventricle. This one is tapetum of corpus callosum. This one is genu of corpus callosum. This is head of caudate nucleus. This one is rostrum of corpus callosum. This one is septal area. This one is anterior perforated substance. This one is amygdaloid body. This one is anterior thalamic nuclei. This one is the tail of caudate nucleus, and this one is the inferior horn of lateral ventricle. So tail of caudate nucleus is forming the roof of inferior horn of lateral ventricle. We can easily see in this figure, and we can easily conclude that as well as amygdaloid body is also forming the roof of inferior horn of lateral ventricle. So in this question they are asking what is not seen in the floor of inferior horn of lateral ventricle. So floor of inferior horn of lateral ventricle as fimbria, yes. Collateral eminence, yes. Hippocampus, yes. Tail of caudate nucleus, no. The big no, because tail of caudate nucleus is seen in the roof of inferior horn of lateral ventricle. So the answer here is D, the tail of caudate nucleus. The next question is which of the following marked areas in the histopathological specimen shows calcification? So we have to first label this figure and then we can conclude what area is showing the calcification. This is the figure of cartilage. So this is the labeling of this figure. This is actually the bone area of secondary ossification center. Then this one is epiphyseal cartilage. This one is resting zone. Then it is proliferative zone. Then this is hypertrophic zone. This one is bone, and it is showing the primary spongiosa. Okay. So the marked area in the histopathological specimen that shows calcification is zone number 3. It is the hypertrophic zone. It is showing the calcification, so the answer here is number 3. The next question is what are the structures passing between the muscle marked as 1 and 2? This one is superior constrictor muscle. This one is inferior constrictor muscle. So the structure that passed between superior constrictor and inferior constrictor is glossopharyngeal nerve and stylopharyngeus muscle. So the answer is D. The next question is at what vertebral level does the part marked in the image lie in a normal anatomical position? This one is ischial spine, and vertebral level that lies at the part marked in the image is S5, fifth sacral vertebrae or tip of coccyx. So the answer here is C, tip of coccyx. The next question is the nerve related to the area marked in the picture has its root value from. The area marked in the image is left lung hilum, anterior part. The nerve passing through this is phrenic nerve. The root value of phrenic nerve is ventral horn of C4. So the answer here is A. The next question is the area marked by the arrow is supplied by which of the following arteries? The area marked in the arrow is intervertebral ventricular septum. It is supplied by anterior interventricular artery. So the answer here is C. The next question is what level of vertebral column does the given cross-sectional image corresponds to? In this cross-sectional image, esophagus is lying left to the midline and crura surrounds that. That pierces crura at T10 to open into the cardiac part of the stomach. This is the section that taken at T10 level because the esophagus is opening slightly leftward to the midline. So the answer here is C, T10. The next question is the structure marked as X in the image A has a direct connection with which of the following structure marked in the image B? So the image A is showing the cerebellum and the image B is showing the brainstem. So let us mark this A and B image. This one is flocculonodular lobe of cerebellum. Let us mark these 1, 2, 3 and 4 digits. The one is red nucleus. The two is superior colliculus. The three is substantia nigra. And the fourth one is cross cerebri. So the flocculonodular lobe of cerebellum is connecting the red nucleus of brainstem. So the answer here is mark structure label number 1. This number 1 is connection. The next question is which of the following statements is true concerning the anatomy of the breast? The first statement is inner quadrants contain most breast tissue. This one is false. Upper outer quadrant contains the most breast tissue. The next statement is ligament of Cooper are found only in lower quadrant. This one is completely false. Superior outer quadrant is the quadrant that contains the ligament of Cooper. The next statement is the tail of Spence extends across anterior axillary fold. This one is completely true statement. And the next statement is breast is made up of 10 lobes. No, it made up of 20 discrete lobes. So the answer here is number C. That is the true statement. The next question is a professor underwent a left parotidectomy. Post surgery she complains of left lower lip paralysis. Which structure is involved? Left lower lip paralysis leads to the cervical branch of facial nerve paralysis. So the answer here is B. Facial nerve cervical branch. Next question is identify the normal anatomical variation given in the following CT image. This is the normal anatomical variation. It is showing the aberrant right subclavian artery. Because this is not a diverticulum, because this is a pulmonary trunk that is showing aberrant right subclavian artery. This is not esophageal duplication, as well as this is not a right aortic arch. This is a left-sided image pointing in the area of left lung hilum. Okay, so this one is aberrant right subclavian artery, which has a aberrant course with the pulmonary trunk that is shown in the image. The next question is identify the marked structure. This marked structure in the vascular radiograph is known as superior temporal artery. This is not a posterior auricular artery or middle meningeal or occipital artery. This is showing the area of temple and temple containing the superior temporal artery. So the answer here is A, superficial temporal artery. Let us move on to the next question. The marked structure serves as a surface landmark for which anatomical structure? The marked structure is pterion. And pterion serves as an anatomical landmark for different structures. Let us see the options. Pineal gland? No. Wernicke's area? No. Stem of lateral sulcus? Absolutely yes. Internal carotid artery siphon? No. So the answer here is C. The next question is a 60-year-old male recovering from facial nerve palsy complaining of food getting stuck between the cheek and the teeth while eating. What is the muscle affected in this case? This is actually due to facial nerve palsy. So the buccinator is the actual muscle that is supplied by facial nerve. The next question is which of the following is not a derivative of neural crest cells? Let us see the option one by one. Ciliary muscles? Yes, it is the derivative of neural crest cells. Retinal pigment epithelium? It is the derivative of neuroectoderm, not neural crest cells. Ciliary ganglion? Yes, it is the derivative of neural crest cells. And melanocytes? Yes, it is the derivative of neural crest cells. So the answer here is B, retinal pigment epithelium. The next question is the cranial component of the neural crest cells leads to the formation of. So the question is actually the factual question, and straightforward answer to that is conotruncal septum, which is actually the aortopulmonary septum. So the answer here is C. The next question is a 15-year-old boy underwent a splenectomy for immune thrombocytopenic purpura. During the procedure, the surgeon noticed bleeding while separating the spleen from the stomach. Which vessels are most likely implicated in this bleeding? So the vessels supplying the spleen are short gastric vessels from the stomach. Okay. So the vessels that are most likely to be implicated during this bleeding is short gastric vessel. The answer is B. The next question is identify the marked structure. This image is showing the formation of notochord. And the marked structure is primitive streak. So the answer here is A, primitive streak. So let us move on to the next question. Which of the following is the first to be formed by the migration of the epiblast along the primitive streak? So migration of epiblast along the primitive streak will first form endoderm. This is the factual as well as straightforward question. So the answer here is A, endoderm. The next question is, during walking, the hip bone on the side of the suspended leg is raised by the action of which of the muscle present in the supporting leg. So supporting leg, gluteus medius and gluteus minimus are the two muscle which come into action and that raise the suspended leg hip bone. So the answer here is gluteus medius. The next question is, identify the marked structure. So this marked structure is known as oculomotor nerve, and oculomotor nerve passes through the superior orbital fissure which lies in the cavernous sinus. So the answer here is A, oculomotor nerve. The next question is, injury to the posterior interosseous nerve leads to. So the posterior interosseous nerve is the deep branch of radial nerve, and that affected will lead to loss of extension of digits. So the answer here is A, because radial nerve will lead to wrist drop. But the deep branch of radial nerve, that is the posterior interosseous nerve, that supplies digits, and that will lead to loss of extension of digits because of the injury to that nerve. Okay. So with this, we complete this recall session. Thank you so much for watching and see you in the next one.